So I worked for the LV Prasad Eye Institute in Hyderabad, India, which is both a healthcare kind of hospital for eye care, but it's also a teaching hospital. So there's faculty and students that are there. And I was based both out of kind of the main hospital in Hyderabad and a rural eye care center nearby, which is kind of it's a hospital that offers all kinds of surgical different services, but it's based in kind of a tier 2 city. And what I worked on for them was thinking about how can you franchise this business model to get some of these newly trained ophthalmologists to open up some of their surgical centers in rural areas, because one of their main challenges is attracting talent into rural areas where the quality of life is maybe a little bit lower and it's a bit harder to get everything done. Actually, the mentor that I worked with at the hospital, he also had attended business school in the past, and so we actually communicated quite a bit before I got on the ground. So he provided me with a lot of kind of background reading and materials to do before I got there, so I could really hit the ground running, because as you pointed out, 4 weeks is really, really short. So I felt like I was able to have at least most of the background done, and then when we got there, it was just a lot of iteration with my mentor and a lot of close communication to make sure I wasn't veering off path or focusing on the wrong things. And I think the great thing about this organization in particular is they made everybody available to me that I would need within that 4-week period to do the project, and treated it as a very valuable project. So we formed a franchising model. We actually presented to about 100 students that were studying there, presented to some investors and banks, and got their feedback on what they thought of this model and what would get them to think about moving to these areas and setting up practices, and what the key challenges would be. So it was really interesting because it was a mix of kind of working with the doctors to understand what they needed, and thinking about kind of the needs of the facility and how you can get into rural areas to provide care when it's hard to kind of attract talent there. And it was just very cool to live in India for a month and kind of interact with the local staff, both on the business side and the healthcare side. I think it was it was definitely kind of a sprint during those 4 weeks, but it was possible to get the right resources in place to get a lot done.